A lot of the things I do as a facial plastic and reconstructive surgeon is to fix things. And oftentimes that is a permanent fix, whether it's fixing a broken jaw or fixing a hole left from cancer surgery. But a lot of times when it comes to things like a facelift, how long does that actually last? So if you ask experienced facelift surgeons who have been doing this for years and are at the top of their game, it's about 10 to 12 years before patients come back for repeat procedures having to do with the aging face after having typically a deep plane face and neck lift. Now what that means is, using surgeon terms, is that at some point the surgery is going to fail down the road, which is totally expected. We use the same terms when we're talking about like a bridge, for example. A bridge does not last for the rest of time. It lasts for a very specific amount of time until it needs further repair. It's the same thing with the facelift. When you're fixing the structures under the skin, you're using sutures and you're using things that are going to hold it for a certain amount of time, but after some amount of time that's going to give way and the signs of aging are going to return. So the seemingly simple question of how long does a facelift last depends on a few things. Now, first of all, technique is going to make a difference as far as how long it lasts. There are different kinds of facelifts. And so knowing what kind of facelift you had is probably a good thing to do as a patient. So then if you do need another procedure in the future, your surgeon can kind of very quickly understand what was done. Another thing to understand is that there are things like thread lifts these days and non-invasive modalities that are just not going to last as long, but will give you some amount of result for a shorter amount of time. My name is Dr. Peter Vila, and I'm a facial plastic surgeon. So even the term facelift is kind of difficult to tease out in terms of what people mean exactly. In my mind, a full facelift means not just a facelift down here, which is what I would consider a surgery, a facelift, or what we call a iridectomy, but actually it would include the brow, would include the eyelids, might include the lip as well. So you're talking about multiple procedures, not just the procedure that we usually mean when we say a face and neck lift. So in this video, I'm not going to talk about the eyelids or the lips or anything else. We're just going to talk about the facelift itself. So a face and neck lift, where the incisions are around the ear, and there's different ways to do that procedure. And depending on how that procedure is done by the surgeon, that's going to give a different longevity to those results. You might hear terms like a lifestyle lift or a weekend lift, where the incisions are placed around the ear and then basically just skin is taken back. No deeper dissection of the tissues is done. That is not going to last a very long time. That's going to give you a year or two maybe of good results, but the skin's going to stretch right back out. Because when you talk about a real facelift done by an excellent facelift surgeon who knows what they're doing, the tension is not on the skin. It's on the tissues underneath the skin, which is the SMAS layer, which is sort of like think of it as a muscular fibrous layer. Understanding the longevity of a facelift has to do with understanding the technique that the surgeon is using. So things like a SMAS plication, which is the most conservative facelift technique, where you're basically, the skin is lifted and then little sutures are placed to sort of pull back on the SMAS layer. And obviously I'm pulling on the skin here, but you can see what it does to the tissues down here. You get a little bit of pull down here from pulling on the SMAS underneath. That's called the SMAS plication. You can also do a SMASectomy, where you remove some of the SMAS and then pull back to resuture it. Or you can do an extended SMAS flap, where the skin is lifted and then the SMAS is lifted and resutured back down to pull again to get the jowls and the nasolabial folds improved. A deep plane facelift is probably going to give the longest lasting results, or a composite facelift. And what that means is, there's differences between those two techniques, but what that means is that the skin is lifted and then it stops right around here. And then in this point, you actually go deep to the SMAS, and the SMAS is dissected down all the way down to around the mouth and up here into the mid face. And then that whole flap is pulled back. So you get really, that's how you're going to get the best improvement in the mid face, in the cheek, and the jowls right here, and the nasolabial folds. Those techniques are going to get the best longevity in terms of a surgical facelift, but not every surgeon does those. So it's a good question to ask your surgeon, what technique do you use, or how do you do a facelift? Things like a deep plane facelift, it's generally going to give the longest results. A smash plication is something that's going to give a less result. It's going to look the same. It might look great for about a year, but then after 1 to 3 years, that result is going to go right back to normal. So what about like thread lifts, for example? If there's a recovery associated with a facelift, why can't I just do a thread lift? Understand what a thread lift is. Thread lifts are basically sutures that are placed underneath the skin, or the threads placed underneath the skin, and they're sort of meant to accomplish the same thing as a surgical facelift, where the pull is back this way, sort of back and up, by placing sutures underneath the skin that come out, and then those sutures stay underneath the skin and sort of promote collagen production to tighten up and thicken the skin. By doing that, the goal is to not only get a little bit of pull on the skin, but to increase the amount of collagen under the superficial skin to rejuvenate the face. Now, those results are going to really only last about 1 to 3 years at best. So the recovery is much faster, but you're also much more limited in what you can do in terms of addressing aging. So when it comes to who's the best candidate for those procedures, a thread lift really is for people in their 30s to 50s maybe, and then anything from 40s to up is going to be surgical facelift territory. You're just not going to get the same results from a thread lift that you're going to get with a surgery. The other thing that's really important to understand is that what a facelift does and what a facelift does not do. So a facelift is really going to reposition the deeper structures in the face and along the jawline. So as we age, descent of the fat pads of the face, descent down here and along the jawline, losing this sharp angle in the neck. With the facelift, you're going to reposition all those things, remove the extra skin to kind of tighten all that up. What a facelift is not going to do is it's not going to iron out those superficial wrinkles. So you may have wrinkles around your mouth, you may have them around your lips here, out here on the cheeks. A facelift is going to improve those for sure, but it's not going to iron those out. And that, to really address those superficial wrinkles, that's when you're talking about a chemical peel, laser resurfacing, other modalities in combination with the facelift that are really going to give you an awesome rejuvenating result. When you're talking about combining those modalities, that's where we're really going to get a slam dunk in terms of rejuvenating the face, in terms of using the facelift to reposition those deeper structures and really address the major architectural differences, and use the laser or the chemical peel to sort of get at the more superficial wrinkles and really combine those for an excellent result. So just to summarize, because we covered a lot in this video, thread lifts, more minimally invasive things like a weekend lift or a mini lift, your recovery is going to be much faster, but your length of the result is going to be shorter. When it comes down to long-lasting results from a full face and neck lift, now you're talking several weeks of recovery for sure, 2 weeks until you're able to get back to work and then start using makeup to camouflage those incision lines, and the swelling will be down to a level where no one else is going to see it. But those results are going to last for years, and some would argue up to 10 to 12 years. I hope that's helpful, and I hope you learned something today, and I will see you on the next video.